There's a few companies in Nashville that are really exciting right now. I think I'll give you a few examples. One would be AmSurge, which made a very significant acquisition in 2014, buying Sheridan, spending quite a bit of money to diversify their surgery center business into a new area in the physician management realm. Sheridan is the largest group of anesthesiologists in the U.S. And I think the innovation there is how do you connect the outpatient surgery center with some of the activities of these large national physician groups like Sheridan. And there is going to be a synergy, I think, that they demonstrate over time. So that's a pretty exciting situation, I think, for Nashville and getting AmSurge in a little bit of a different direction. The other company is a private company that we don't follow per se, but is something that we've watched from afar, and that's Nava Health, and they're really innovating in the post-acute care market, where we're seeing a lot of business models change, and I think that their business model is unique in that they're developing some ways to help manage care and to help Medicare Advantage plans manage patients differently once they come out of the hospital. So in the nursing home setting, in the home health setting, in the inpatient rehab setting. And that's leading to better quality, lower costs in the post-acute area where there tends to be a lot of excess spending and sometimes some waste. So those are some examples of Nashville-based companies that are innovating.
So the Affordable Care Act passed in March 2010 and created the biggest change in the healthcare landscape that we've seen arguably since 1965. I think you've seen several examples of what we would have considered, strange bedfellows previously. Since that implementation, DaVita made a large acquisition of a delegated provider group. You've seen surgery centers come together with staffing companies. You've seen post-acute providers buy home health. So I think that will continue as providers expand their reach across the entire continuum of health delivery.
Consolidation has been an ongoing theme in healthcare for quite a while now. We've seen it broadening out into new areas this year, the post-acute area, for example. We've seen some deals announced where people maybe in rehab or buying home health care, or long-term acute hospital operators and nursing home operators looking at home care as a forward integration model. And we've certainly seen consolidation in the managed care space. Part of that is driven by a desire to leverage costs in an environment where your medical cost ratios limit your profitability sort of at the gross profit level and require you to get leverage on the operating expense line. We've seen hospital consolidation on an ongoing basis. I think that will continue to accelerate, particularly in the rural markets. We see a lot of activity there as people are struggling to come up with the money to make important capital investments that are needed to compete in the new world of health reform. So I think we'll see consolidation be an ongoing theme in the group, and it's something we look at quite carefully to see who's going to be the winner and who's going to be the loser at the end of the day.
We'll see consolidation continue into 2015, and let me just take a step back and focus on the behavioral health care market for just a second, which I think still remains very highly fragmented. There's a lot of opportunity in the inpatient psych business as well as substance abuse, and now that we have a pure play substance abuse provider that is a public company, I think that you'll see that there's going to be a lot more activity given the fragmentation. With favorable legislation, I think demand is increasing, and I think that's going to open up the opportunities for a really robust M&A pipeline in 2015 and beyond.
This Nashville event here today with analysts from all over the country. As you probably know, we have 15 public companies in Nashville. This is a fantastic event because it gives a lot of people the opportunity to learn about the investment community. But more importantly, it's just another indicator of how great the Nashville Healthcare Council is and what a great job they've done. And having as many people we have here today with so much support, it just speaks so well of this community. There's no other community in the country that has this kind of support for their healthcare council. So I'm very appreciative of everybody's support, and I'm appreciative for being a part of the Nashville Healthcare Council.